All right, so we are going to continue on with chapter 11 in your pharmacology books. So we are on slide 32, going into urinary tract diseases and disorders. So urinary continence is defined as the involuntary loss of urine. Types of urinary incontinence includes urge or overactive bladder, overflow incontinence. So symptoms of that include urgency, frequency, incontinence, and pain. Urinary incontinence medications, Enablex, Toviaz, Urispas, oxybutynin, Trospium, which is Sanctura is the brand name. These all work by relaxing the smooth muscle tissue in the bladder. Some of these do cause drowsiness, some of them don't, but most of them actually have a side effect of dry mouth. So urinary tract infections. These occur when bacteria enter the opening of the urethra and they multiply. This usually begins in the lower tract, and if not treated, it will progress into the upper tract of the urinary system. Diagnostic criteria includes the presence of bacteria in the urine, so they do a urine dip, and then symptoms. So types of UTIs, you have cystitis, which is the lower urinary tract, prostatitis, and paleonephritis, which is in the upper urinary tract. So from that point, it's moving from the bladder up the ureters and into the kidneys, which you can end up with a kidney infection. So urinary tract infections are bacterial infections, so they are treated with antibiotics. So the common antibiotics used to treat are amoxicillin, Augmentin, which is an amoxicillin combination, Cipro or ciprofloxacin, and then Hyprex. Most of these do have other cautions, so making sure that you're taking with food, avoiding certain foods like antacids, avoiding certain drugs. Cipro does have black box warnings, so these are things that the pharmacist will discuss with the patient. Bactrim or Septra is another common one. This one requires the patient to drink plenty of water with that. Nitrofurantoin, which is the macrobid and the macrodatin, they actually have similar side effects as Antabuse, which is a medication that is used for alcoholics. If they take the Antabuse and then they drink alcohol, it will cause severe projectile vomiting, and these can cause the same thing. So you want to make sure that you're putting a do not drink alcohol auxiliary label on there. Your urinary analgesic is phenazopyridine. It can be prescribed through a prescription, but it is actually also available over the counter in a 75 milligram dose known as Azo. That's the brand name that you'll find over the counter. This drug does color the urine orange, and will stain anything that it comes in contact with. It can stain the toilet and then any underwear that you're wearing. The urinary analgesic should not be taken more than 2 days because if you're taking it longer than 2 days, that means you're not treating the infection. Benign prostatic hyperplasia is BPH. This is an abnormal enlargement of the prostate gland. This becomes a problem when it obstructs the urine outflow from the bladder. And you can see a photo of that and how that works on slide 38. We use alpha blockers, are typically the drug of choice. And these are especially the drug of choice in patients that not only have BPH but also have high blood pressure. Alpha blockers include doxazosin, prazosin, tamsulosin, terazosin. Key word here in the suffix is that many of the generic names of the alpha blockers contain osin at the end. Your 5-alpha reductase inhibitors, these used to treat BPH. They inhibit the conversion of testosterone into its active form of DHT, which will in turn result shrinking the size of the prostate. This is very harmful to unborn babies or developing babies. So women and that are pregnant and women of childbearing age should always wear gloves when handling these particular agents. Dutasteride, finasteride, which is the generic name for Propecia or Proscar. Again, these work very well in reducing the size of the prostate. Proscar and Prozac. So Prozac is a antidepressant medication, and Proscar, which is the 5-alpha reductase inhibitor used for BPH. These are what we call sound-alike, look-alike drugs. And so these two drugs have been confused and filled incorrectly one way or the other. Diuretics. So diuretics are a substance that increase the volume of urine output. The use of diuretics improve the urine output. They reduce the blood volume. They treat edema, which is excessive fluid accumulation in the body or water. They in fact enhance the effectiveness of other drugs. So acetylcholine is the only carbonic anhydrase inhibitor. It works to increase the excretion of bicarbonate ions in the nephron, which carry sodium, potassium, and water into the urine. They also use acetylcholine not only for or as a diuretic, but also for glaucoma patients, because glaucoma is a result of intraocular pressure that is usually fluid-based. So they use that to help decrease the fluid of the eye, which will relieve some of that pressure on the optic nerve. Loop diuretics. So they inhibit the reabsorption of sodium, chloride, and water, and they only work in a particular part of the kidney, and that is in the ascending loop of Henle. This produces a fast and profound diuresis, which means expelling of excess water. Heart failure, kidney failure, high blood pressure, those are a lot of different things that can cause edema or excess water weight or gaining or retention of water. So that's why the diuretics are necessary. One thing to think about with all of these diuretics, except for the potassium sparing, is these diuretics are designed to get rid of everything. Potassium is a very essential element in our body. It affects how our heart is functioning properly. And when we take diuretics outside of the potassium sparing, they do not replenish the potassium back in our body. It just expels it out. So that's why it's always important for pharmacy technicians to be watching for an order for a potassium supplement. If you do not see one, you're going to alert your pharmacist, and then the pharmacist is going to talk to the patient to make sure that the physician talked to them, told them to get one over the counter, or if the physician just forgot to call in a potassium supplement prescription. Your loop diuretics, so furosemide, the brand name is Lasix. The name was designated to indicate its approximate duration of action, which is 6 hours, so Lasix, okay. Potassium sparing, they block the exchange of potassium for sodium in the distal tubule. The resulting effect is sodium and water excretion without the depletion of potassium from the body. So the potassium sparing are the only ones that do not deplete the potassium levels in our body when we take these. Spironolactone, triamterene, these are potassium sparing. So if you see these come through, you're not going to look for a potassium order because these are designed to not deplete the potassium from the body. Your thiazide and thiazide related, so they promote water and sodium excretion in the urine, which will help lower sodium levels in the blood and therefore reduce vasoconstriction, which can in turn decrease high blood pressure. The increased sodium in the urine is exchanged for potassium, which results in potassium loss. So again, thiazide and thiazide related, loop diuretics, carbonic anhydrase inhibitors, they do deplete potassium levels, so it's important to have a potassium supplement on top of that. So complementary and alternative therapies. So like dietary supplements or natural supplements. Saw palmetto is one that has actually been used for centuries to help treat BPH symptoms. In clinical studies, the saw palmetto is shown to have similar efficacy in the compared to finasteride in symptom reduction. Reduces the thickness of the prostate gland's inner layer. Side effects do include dizziness, vomiting, headache, constipation, and saw palmetto actually does have some drug interactions, so it's important to make sure that we get a complete profile of what the patient is taking before we go recommending any over-the-counter dietary supplements. Cranberry juice. Cranberry juice or even cranberry supplements, you can get them in capsule form. They are used for the prevention of recurrent urinary tract infections. So studies have shown that giving a cranberry supplementation to pregnant women, elderly women in particular, and patients who are in the hospital and possibly catheterized, a daily supplement of cranberry has worked really well because this prevents the bacteria from adhering to the inner walls of the bladder. So if you have an active infection, it's not going to treat that infection. It's going to prevent it from spreading, but it's not going to kill the bacteria that has already adhered to your bladder walls or your urethral walls. This is a preventative thing. So you take it every day to prevent in the event you have bacteria introduced into the urinary tract system, it will prevent it from being able to adhere to the bladder walls and taking hold and starting to cause that infection. There are upset stomach side effects. You can have diarrhea if it's consumed in large amounts. And then the only drug that they have found so far that it interacts is warfarin or Coumadin, which is a blood thinning agent. And that takes us through to the very end for Chapter 11. If you have any questions, please feel free to call or email me.